So now to a checklist. What do we need to be aware of when we're traveling? Hopefully we'll be doing that again soon.
Yeah. Well, the major thing is if you're traveling, if you choose to have insurance, travel insurance, check whether it covers you with diabetes. A lot of travel insurances don't, or you might need a health check or something. So people with type 1 diabetes, for example, have a lot of difficulty getting travel insurance for the diabetes. But have good health insurance. Be aware of, if you're travelling to other countries, whether they have a reciprocal health agreement with Australia. Quite a few of them do, not all of them though. And that's where, if you're travelling to one that doesn't, you really need to have good health insurance to cover you overseas. You also need to think about, okay, how much medication you're taking. Where does the medication get stored when you're traveling? For example, if you're taking some medications like insulin, do not put it in your luggage because it's got the potential to freeze when it's in the hold. So you take it in on your carry-on luggage, and usually you take at least double the amount that you want to use while you're away and have it in 2 separate bags, just in case one goes astray. You need a letter from your doctor with all of your details, and you'd need to consider how long you're going to be traveling for and how your medications are going to be stored, because they need to be stored at the right temperature for them to last a long time. So talk to your pharmacy or have a look at the Diabetes Online shop to see there's different carry-on, insulin or medication storage cases which will keep things at different temperatures for different lengths of time. And always carry food or snacks. For example, I've done some local flying recently. The food is a lot more limited. I didn't usually rely on it anyway. But, for example, if you think you need a particular type of meal, let the airline know you need a particular type of meal, but have plenty of your own snacks anyway. They'll probably be healthier, but also it's the amount of carbohydrate. You might need to be able to tailor your carbohydrate intake to your medication, or vice versa, depending on what medication you're on. And often the airlines don't, for example, provide you with the amount of carb that you might need. It's usually high energy though, so not good for the waistline. But the other thing to do is to make sure you have a good time while you're away. And if you do have a health issue, get medical assistance. Don't wait around, because there's nothing worse than coming home and having a horrible infection in your foot or something. Get it seen while you're away. Get it treated.